Hi, my name is Rob from Cancer Fit Australia. I am in charge of the exercise program here at Cancer Fit.
Hi, my name's Lina Pugliano. I'm a medical oncologist and I run the survivorship section of Cancer Fit Australia.
And today we're going to discuss how to prep for a DIEP operation. So what are your top considerations for a patient when they are prepping for a DIEP?
So we get a lot of patients that have come through whose ultimate goal for their breast reconstruction is a DIEP surgery. And there's lots of things that's going through my head when I'm seeing the patient for the first time. Probably the biggest thing that I'm thinking about is where they are in their treatment path. So some people will be having chemotherapy, some people will have finished their chemotherapy and might be up to radiotherapy, and some people have had all of those treatments many years ago. If they are in the middle of their chemotherapy or radiotherapy, there's lots of things that I want to know from them, particularly what are their treatments, what complications they've had from their treatments, because we know that there are some very specific complications that happen from breast cancer therapies and chemotherapy, particularly cardiac toxicity and impacts on your heart. So knowing that allows me to talk to you a little bit better about how to choreograph their exercise. I think the other thing is, in terms of chemotherapy particularly, we know that there are effects on their physical capabilities going through chemotherapy. So people don't finish chemotherapy the same way they started chemotherapy in terms of their activities, what they can do. So most people will drop up to 20% their cardiovascular fitness, they will lose muscle, they'll lose strength. So going into a big operation like a DIEP, they're not at their peak performance. So I need to know where in that trajectory they are. The other thing is, of course, the timing. So how long have we got to improve where this person is now to where they could possibly be before an operation? And so if it's 2 weeks out, that's a very different scenario compared to being at the start of their chemotherapy, not even getting deconditioned because they're engaging in exercise.
Yep.
Or being halfway through and making the decision that they're going to go down this pathway for their reconstruction and they have had some deconditioning. And just knowing what their other comorbidities are. So do they have other musculoskeletal problems that are going to impact, how they're going to be able to perform? Do they have a peripheral neuropathy from the chemotherapy that we've given them that, might impact how we need to train them and exercise them? And I guess I'm the bridge between the medical to the exercise.
Yep. So it sounds like their conditioning is critical. The physical preparedness is critical in leading up to this major operation.
So it's pretty important because when they've done the DIEP, there's definitely a period of reduced mobility in terms of activities of daily living. So, and activities that they would be doing physically. So there's automatically a portion there where they've got their fitness that has the potential to drop off and their muscle mass, which has the potential to drop off further.
Yep.
On top, it's a pretty big operation. And so there's microsurgery involved, there's drains, there's wound healing. So getting someone as good as they possibly can be physically means that their recovery post-operatively is just so much smoother. If they've gained muscle, then you're in a better place. If
Bigger
you lose,
buffer, yeah.
you've got a bigger buffer is the way of saying that.
Yeah.
What do you think when you're preparing someone for a DIEP? What are you thinking about in terms of your exercise?
So obviously the timing is probably going to be the biggest factor. If you're 2 weeks out from the operation, then we don't have a lot of time there. But let's say we have all the time we need to prep for this operation. In priority, number one for us would have to be the overall cardiovascular fitness, cardiac function. So the fitter they are, generally speaking, the better recovery they will get on the other end. So if someone who has very little time with us, the biggest focus is going to be on that. That's the biggest bang for your buck. If we have more time, the second thing we're going to focus on.
So what's more time?
For what we see here, like if we have, I would say, 5 weeks to improve someone's cardiac function, if more time meaning 10 to 12 weeks, okay, that would allow us to have more time to work on the secondary thing, which will be your muscle strength, in particular muscle endurance. And not just any muscle group, but your posterior chain. So your back muscle, your shoulder blade, your lower back, your glute, your hamstrings. And the reason being is you can anticipate that obviously your stomach region is going to be super tight. So it's going to be a lot of rounding forward. And we know that because that's the feedback we're getting from patients. And what we want to do.
That tightness is something they talk about.
Yeah. So what we want to do is, in anticipation, we want to train the antagonist muscle group as strong as they can be, with the most amount of endurance they can have, hoping that post-op, the recovery of being more straight is going to be quicker, which in our case, observing a lot of patients coming through for DIEP, it is the case. So that's the second biggest thing we focus on. If we have more time than that, we're going to focus on overhead mobility and flexibility. Overhead, because obviously we know that we're going to be tight at the front, and a lot of people will be kind of round forward. People are more likely round forward in today's world anyway, from mobile phone and computers. Overhead mobility, which means that we're going to mobilize and stretch all the muscle groups that's in front of our body, and to avoid and minimize any potential shoulder stiffness, injury, and pain post-operation. Those are the three things that we look at.
And what would be your biggest tip to someone who's thinking about undertaking a DIEP?
Do it as soon as you can. The more time you exercise, get into a prehab program as soon as you can, because the more time you allow yourself to be ready, the better you're going to be on the other end of the operation, the quicker the recovery. I remember the first lady that we helped going through her DIEP, and she was walking the next morning, virtually pretty much upright. And the feedback from the surgeon was, this is insane, like, haven't seen this before. And she felt really good. Surgeon was super happy.
She trained for 12 weeks.
She did train for 12 weeks. And so she has given herself sufficient time to prep for the op. And the end result was really good for everyone.